Thank you very much for joining us once again. My name is Peche Sedu. Now, the police hospital would this evening shut portions of the facility to allow for fumigation exercise. This would compel the hospital to attend to only emergency cases. Management says all outpatient department OPD cases would, as a result, be transferred to other health facilities in Accra. Let's have a conversation on this. I'm joined in the studio now by the Public Relations Officer of the hospital, Faustina Afia Nunokweku, and she is the Public Relations Officer of the hospital. She joins me in the studio. Good morning to you, madam. Thank you for joining us.
Good morning.
First of all, why has it become necessary to do the fumigation exercise now?
Okay, thank you very much, and a very good morning to your viewers. Yes, it has become necessary because first, we would want to have a very conducive environment and atmosphere for our doctors, nurses, and administrative staff. We wouldn't want a situation whereby a nurse is going to inject a patient or insect some lime and then a cockroach or a mosquito bites the person. You can imagine what will happen. And then also we want to prevent our clients from acquiring diseases from the hospital acquired diseases. For instance, you come with a headache, a stomach ache, and then after you've been treated, you go back with some kind of malaria. We want to prevent that one. And thirdly, we also want to keep our the records of our clients and some important documents safe from rodents and the likes.
And how long will this exercise be for?
It's going to go through from this evening up to Monday. Actually, on Monday, we'll go to the various offices and departments and then open up, clean up, and get the place ready for work on Tuesday.
Okay, so it means that work will actually start from Tuesday morning?
From Tuesday, yes.
But which departments would you exactly be shutting down?
Yes, the radiology department. That is where we've been having our x-ray, the pediatric department or the children's ward, for instance, our chemists, and then our stores, and also the general administration, where the clerical works and administrative works goes on. And
the radiology, that's where you do your x-rays and all of that, right?
Yes,
so what happens to those who are on admission who would have, the doctors would have to perform x-rays on? What happens?
So that is why I'm using this medium to tell and urge our clients. We know they like what we do and they always come to us, but it's also for the benefit of them. It's for their benefit too. So they should direct all of such cases to the nearby clinics or hospitals. La General is there, Rich, 37, and maybe Kolibu or any closer clinic.
Yes, we'll come to what sort of special arrangements you've made for them. But I asked earlier about those who are on admission. What happens? What is the plan?
Okay, for those on admission, as at Thursday and then yesterday and then today, we tried as much as possible to discharge them so that they continue with their medication at home. So today we are not doing any admission at the OPD. We are not admitting any child at the children's ward. But if it is an emergency, that's when we will look at it and get the person stabilized.
So does it mean that as we speak, there's not a single person on admission at the police hospital?
The exercise will actually begin at the close of work, so maybe by 6 o'clock. And before then, they would have been discharged.
And you have already said that you will be treating only emergency cases,
yes,
and all OPD cases will be transferred to other health facilities in Accra.
Yeah.
Educators, what cases do you put in the category of OPD?
Okay, for OPD cases, the outpatient departments as it is, that is where there is actually the first point of call when you get to the hospital. So over there, maybe you have a headache, you have some stomach ache, and maybe the doctor would have to give you some prescriptions so that you get the medication and then get the medicine and then continue the medication at home. That's the OPD cases. So with such cases, you'd have to go to the hospitals that I just mentioned. But if an emergency, like maybe there is an accident and the person just can't go anywhere, in fact, that's when we'll look at it, get the person stabilized, and then if there is the need for the person to be referred, we will do that. If we have to admit the person, we will do that. But in as much as we are closing down the radiology, the pediatrics, and all those departments for the fumigation, the maternity wards or the gynec department, they are working. The female wards, male ward and the other wards are working. The physiotherapy, all the other departments are working, just except this ones.
So let's talk about those patients who have regular visits at the hospitals, and they may have to visit per the timetable given them by their doctors or nurses. These periods that you are shutting down partially, they may have to visit to get their treatment. What happens to them as well? Are there any special arrangements?
Well, if we look at the time, if you should visit the hospital from this time up to maybe 4 o'clock, we can look at you. After 5, 6, then the exercise is about to start. So we'll just tell you that, oh, please go to this hospital because of A, B, C, D.
Yes, but I don't know whether you get me. What I mean is, if, for instance, the doctor said that come tomorrow is Saturday, come Sunday, come Monday, and it's already booked, have you already pre-arranged with such health facilities where they can easily go without any difficulty?
Yeah, I know the doctors are aware, so they wouldn't give any appointment on these days. There is no appointment during these weekends. So if there is any appointment, it has to be on Tuesday, Wednesday, Thursday. So there is actually nothing like that. And
we do know from research around that fumigation sometimes could have health implications for even those who are applying them as well as those people around. Are there any measures in place to ensure that people don't get infected through what you're going to do?
Yes, we have employed a very specialized, a very good company to do that for us. So they are going to be in their protective jackets. And then if you're not supposed to be there, you don't have to be there. If you have to go do something there whilst the exercise is going on, then you have to be protected. You have to get your masks and then some protective jackets.
Any final words?
Yes, we would like to tell our clients, the good people of Ghana who are so content with the work we're doing for them, that we know this might kind of inconvenience them, but they should just bear with us. It is just for their good and ours. So by Tuesday, work continues.
Thank you very much. And you heard Faustina Efia Nunepeku. She is the Public Relations Officer of the Police Hospital, telling us that portions of the facility will be shut down this evening. And so if you're planning of visiting the Police Hospital, be reminded that between this evening and Monday, some portions of the facility will be shut down. And so if your case falls in the category of the OPD, then you may have to consider other health facilities in Accra.